Hi, my name is Naomi. My presentation is on effects of 7 days of exercise training on insulin sensitivity and responsiveness in type 2 diabetes mellitus. Type 2 diabetes is a chronic condition that affects the way your body metabolizes glucose, an important source of fuel for our body. Our body either resists the effects of insulin or doesn't produce enough insulin to maintain normal glucose levels. Insulin is a natural hormone made by the pancreas that controls the level of the sugar glucose in the blood. Insulin permits cells to use glucose for energy. Cells cannot utilize glucose without insulin. Exercise has a number of beneficial effects that can play important roles in the prevention and treatment of insulin resistance that leads to and mediates type 2 diabetes. In addition, exercise has short-term effects that enhance insulin action. The main objectives of this research is to see if there is improvement in insulin sensitivity, responsiveness, or a combination of both due to short-term exercise training in patients with type 2 diabetes. Secondly, this research determines if short-term exercise training results in an improved suppression of hepatic glucose production by insulin. Overall, the study is important because the research is to find a way to lower glucose production while researching sensitivity and responsiveness to insulin with those who have type 2 diabetes or individuals who are at high risk of type 2 diabetes. If exercise can reduce the production of glucose by insulin, then exercise can be scientifically proven to reduce risk of type 2 diabetes. The participants chosen were obese patients with type 2 diabetes that were 62 to 66 years old. They underwent a two-stage hyperinsulinic glycemic clamp procedure, which they were receiving a 40 milliunit insulin infusion and a 1,000 milliunit insulin infusion, along with a glucose infusion before and after 7 days of exercise. The training consisted of 50 to 60 minutes of both cycling and treadmill walking of maximal aerobic capacity for 7 days. Prior to the research, there were procedures that were taken. Participants were screened via medical history questionnaire, an oral glucose tolerance test, an exercise stress, and blood chemistry profiles. On 7 consecutive days, volunteers performed 50 to 60 minutes of exercise consisting of treadmill walking and stationary cycling at 80 to 85% of their maximum heart rate. Prior to the study, a 3-day outpatient control period was used to monitor adequate calorie intake using dietary intake questionnaires. Body composition was measured by standard techniques using a collaborated scale and statometer. Body density was determined by hydrostatic weighing. Each participant performed an incremental treadmill exercise test to determine their VO2 max, which was performed more than or equal to 4 days prior to other metabolic measurements. After these procedures, the insulin action that I said above was performed. The first graph shows the difference between pre-study and post-study of glucose disposal rates of 2 insulin infusions after exercising for 7 days. Glucose disposal ensures that carbohydrates from the individual's diets get stored as glycogen in muscles rather than fat. The graph shows that glucose disposal rates during the glycemic clamp was significantly increased at both hyperinsulinic stages after training. Usually, basal hepatic glucose production is increased in diabetic states. In the next graph, we see that hepatic glucose production is decreased in the basal state and during the 40 milliunit insulin infusion after exercise. Previous studies on healthy young humans and on laboratory rodents have shown that exercise can result in an increase in insulin sensitivity, but did not acknowledge that there is an improvement in insulin responsiveness. The specific lab proves that insulin responsiveness is correlated to the 7-day exercise program. The rate of glucose disposal expressed relative to the maximal rate was 25% higher, which means that there was an increase in insulin responsiveness. When the individuals exercise, there is an increase in the number of GLUT4, a glucose transporter, which results in glucose to respond to insulin stimulus. The actual GRD after training was 2.6 milligrams, which increased from the average rate of glucose disposal, which provides evidence that there is an increase of insulin sensitivity. The main takeaway is that vigorous exercise for only 7 days result in significant improvements in insulin action and insulin-resistant patients with type 2 diabetes. These improvements in insulin action involve a combination of enhanced sensitivity and responsiveness of glucose uptake to insulin, as well as an increased inhibition of HGP by insulin. Those who have type 2 diabetes can slowly get rid of this condition by implementing exercise every day in their daily routine. An example would be a patient finding out that they are at risk of being diabetic due to their current lifestyle. This research has made it evident that the doctor will recommend them to aerobically exercise for 50 to 60 minutes a day, along with having a better diet, so they can reduce the risk of being diabetic. We know that walking, whether on a treadmill or not, or cycling on a machine or an actual bike, are the few exercises an individual can do to decrease glucose production, which improves their body sensitivity and responsiveness to insulin, overall avoiding the risk of type 2 diabetes. Thank you for listening to my presentation.